Welcome to the deep dive. Today, we're really plunging into some fascinating sources you shared all around brain health.
Yeah, it's a big topic. We're touching on dementia, Alzheimer's, even ADHD.
Right. And the mission here is, well, to cut through the noise, find the most crucial insights, maybe some surprises, and figure out how you can actually, build a healthier brain.
Exactly, because you told us you want the knowledge, but quick and deep, right?
Yeah.
You want those aha moments without getting totally overwhelmed.
And you appreciate seeing different angles. So the main source today, it's a YouTube transcript.
Featuring Dr. Daniel Amen. He's a pretty big name.
Yeah.
Celebrity psychiatrist, brain health expert.
12-time New York Times bestseller. So yeah, he knows his stuff.
And his core message, right from the start, is pretty powerful.
What's that?
He says, you are not stuck with the brain you have. You can make it better.
Okay, I like that. You're not stuck. Let's unpack that. Why is this focus on the brain so urgent, like right now?
Well, it's interesting how Dr. Amen frames psychiatry itself. He kind of calls it out. Says it's the only medical field that often doesn't actually look at the organ it treats, the brain.
Huh. When you put it like that, yeah.
Yeah.
You wouldn't create a heart condition without looking at the heart.
Exactly. And then he hits you with the stats on dementia and Alzheimer's.
Yeah.
They're sobering.
Give us the rundown. What are we talking about?
Okay, so just last year, 2023, 6.7 million Americans over 65 with Alzheimer's.
6.7 million. Wow.
Yeah, that's about 1 in 9 people in that age group. And globally, 55 million.
And isn't there something about women being affected more?
Yeah, 2/3 of those with Alzheimer's are women.
Yeah.
It's a significant difference.
And the future projections, they're not looking great, are they?
No, they're alarming, frankly. The CDC is talking about a potential 7-fold increase in the U.S. by 2060.
7-fold.
Yeah, and globally, jumping from that 55 million now to maybe 139 million by 2050.
That's huge.
And here's a really stark one he mentions. If you live to 85, your chances of getting diagnosed with dementia are basically 1 in 2, 50-50.
1 in 2. That really hits home. But he doesn't just leave us there, right? He offers some hope.
Definitely. That's his whole point. He argues against this idea that it's inevitable.
So it's not just about aging.
Well, yes, lifespan is increasing. The baby boomers are aging. That's part of it. But he strongly believes our lifestyles are a massive driver. Undisciplined minds, unhealthy habits.
Right, so this links back to his main message. You can impact these odds.
Exactly. He's been working on this for years. His books, like Preventing Alzheimer's back in 2005 and Memory Rescue more recently, they're all about tackling these 11 major risk factors.
Okay, so let's get into those. One big hurdle seems to be this feeling about genetics. Like, if it's in your family, you're doomed.
Yeah, that's a huge misconception he tackles head on. He even has this mnemonic, bright minds. We'll get into the specifics later, but the G is for genetics.
So what's the common feeling he's pushing back against?
It's that feeling of, oh, my dad had high blood pressure, my mom was overweight, my grandparent had Alzheimer's, so I'm next. Like, you have no say in it.
But that's not his view at all.
No. He says, look, genes might make you more vulnerable, sure, but they also act like a roadmap. They show you where you need to be extra careful, where you need to put your preventative efforts.
So it's information, not destiny.
Precisely. He uses his own family history, obesity, heart disease, and how he's actively worked against it. He talks about his adopted nieces, how their family history of addiction doesn't define their future if they're proactive.
So lifestyle is key. Beyond just aging, what else is pushing these cognitive decline numbers up?
Well, as we said, unhealthy lifestyles are huge, but he also makes a really strong connection between depression and dementia.
Oh, interesting. How strong?
He says depression doubles the risk of Alzheimer's in women and quadruples it in men.
Quadruples. Wow.
Yeah. And he points out that depression, especially in older adults, shouldn't just be seen as a mood issue. It can actually be an early sign of dementia.
Because they're both brain issues, ultimately.
Exactly. It all comes back to the brain's health, which leads us to maybe the most hopeful part, neuroplasticity.
Right. The idea that the brain can change. What was his big realization there?
He's been looking at scans since 91, like over 250,000 of them. And the big takeaway, the consistent theme, is you can make your brain better. It's not fixed.
And he has examples, right? Good and bad.
Totally. Bad stuff, car accidents, drugs, lack of sleep, even going through a divorce. You can see the negative changes on scans.
But the flip side.
The flip side is you can improve it. That NFL study he mentions, huge. 80% of the players in the program showed better brain scans afterwards.
That's powerful. He was involved in that movie Concussion, wasn't he?
Yeah, he consulted on it, but he was actually kind of disappointed.
Why?
Felt it focused too much on the damage, not enough on the hope, on the potential for recovery and improvement, which is really his core message.
So neuroplasticity, that's the exciting lesson.
It really is. He uses this great image of the hippocampus,
Yeah.
the memory center.
Shaped like a seahorse, right?
Exactly. Greek for seahorse.
Yeah.
And he says we make about 700 new stem cells there every day, like little baby seahorses.
Yeah.
And our choices, our behaviors, they either help those baby seahorses grow or they cause them to shrink. And that shrinking makes you more vulnerable to dementia.
That's a fantastic way to picture it. Now, his whole approach really seems to hinge on actually seeing the brain imaging, SPECT scans.
Yeah, that's central to his work. And his journey into it is pretty fascinating. Started way back when he was an infantry medic.
Oh, really?
Yeah, then an x-ray tech. But the real turning point was personal. His wife attempted suicide back in '79. That led him to psychiatry.
Okay.
But he got frustrated. This feeling again. Why aren't we looking at the organ we're treating?
Yeah.
That led him to SPECT in 1991.
So what exactly is SPECT? Break it down for us.
Okay, SPECT stands for Single Photon Emission Computed Tomography. It's a nuclear medicine study. Basically, it looks at two things: blood flow and activity patterns in the brain.
Blood flow and activity. So how does it show that? What's the process like if you get one?
Well, you get an injection of a radiopharmaceutical. It sounds scarier than it is. It's a safe, tiny amount of a radioactive tracer, usually technetium linked with another substance.
Okay.
It goes into your arm, travels to your brain, and about 70% gets taken up by brain cells really quickly, like within 2 minutes. This tracer gives off tiny signals, photons.
And the machine picks those up.
Exactly. You lie down, and this special camera rotates around your head for about 15 minutes, collecting millions of these signals. Then a computer puts it all together into a 3D map,
A map showing. What?
showing where there's healthy activity, where there might be too little activity suggesting underactive areas, or where there's too much activity, maybe suggesting overactive areas.
But he's careful to say the scan isn't everything, right? It's not like scan says this, so you have that.
Absolutely not.
Yeah.
Crucial point. He always emphasizes it's part of the picture. Diagnosis always involves detailed history, interviews, cognitive testing, all that. The scan adds biological data.
He tells a story about his very first scan patient. That sounds like it was a big moment.
It really was. This woman had attempted suicide. Dr. Ammon suspected adult ADD based on her impulsivity, her history, her son having ADD,
Yeah.
but she resisted the idea.
Okay.
So he did a SPECT scan. One at rest, one while she was doing a concentration test. At rest, her brain looked pretty normal.
But during concentration.
Big difference.
Huh.
Activity dropped in her frontal lobes, the focus and decision-making parts, and her cerebellum.
Wow. So the scan showed why she struggled to focus.
Exactly. And seeing it was transformative for her. He showed her the images, explained it wasn't her fault, it was how her brain was functioning.
Yeah.
Like needing glasses.
And she accepted the diagnosis then?
She cried, apparently. Huge relief. It lifted the shame. She got on board with treatment, finished college, got a better job. It showed him the power of making the invisible visible.
Incredible story. But using scans this way in psychiatry? It wasn't immediately accepted, was it? He got pushback.
Oh, yeah, definitely. Early on, the American Psychiatric Association wasn't keen. It didn't fit their diagnostic model, which is mostly based on symptom checklists.
And people questioned the science behind it.
They did. Criticisms about lack of proven efficacy, but Dr. Ammon points to his research like over 80 published papers.
Okay.
Plus, recognition like that Discovery magazine piece, and now even the Canadian Association of Nuclear Medicine has guidelines that align with his methods. He basically says, the proof is in the pudding, look at the data, look at the outcomes.
And he keeps coming back to that core frustration.
That psychiatrists are the only doctors not looking at the organ they treat.
Yeah.
He feels very strongly about that. If the brain controls everything we do, think, and feel, why wouldn't you look at it?
Makes sense. And his conviction seems to have been massively reinforced by a really difficult family situation. His nephew, Andrew.
Yeah, that story is,
Wow.
it's pivotal. 1995, his 9-year-old nephew suddenly starts having major issues. Aggression, disturbing drawings, suicidal themes.
That's terrifying for a 9-year-old.
Absolutely. The standard path would be meds, therapy. But Dr. Ammon, with his scan experience, suspected something physical in the brain, specifically the left temporal lobe.
Involved in emotion, memory.
Exactly. So they did a SPECT scan, and sure enough, it showed a lack of function right there. Further tests found a cyst, a big one, golf ball size.
Oh my God. in his brain.
Yeah, taking up space in the left temporal lobe.
So what happened? Did they operate?
Well, this is where it gets alarming. The first neurologists they saw were hesitant. Said they'd only act if he had seizures or passed out.
Despite the severe behavioral changes.
Right. Dr. Amen was furious. He pushed, found a neurosurgeon at UCLA who immediately saw the danger and operated.
And Andrew?
The change was dramatic. The day he woke up from surgery, he smiled at his aunt, something he hadn't done in a year.
Yeah.
The aggression, the dark thoughts, gone.
That's incredible.
And get this, the surgeon found the cyst had actually thinned the skull bone over that area. Andrew was incredibly close to a potentially fatal injury if he'd hit his head.
Wow.
Yeah.
Wow. You can see how that would change everything for Dr. Amen.
Totally. He said after that, he lost his anxiety about challenging the system. It just solidified his mission. You have to look deeper than just the symptoms.
Which really highlights the limits of just labeling things based on behavior, doesn't it?
Absolutely. He's critical of just slapping on a label like depression or anxiety and throwing meds at it without digging for underlying causes.
Like what kind of causes?
Well, diet, sleep, obviously, but also things like undiagnosed Lyme disease. He mentions a patient misdiagnosed with schizophrenia who actually had Lyme, or mild traumatic brain injuries. People dismiss bumps to the head, but they can add up. Even infections.
He tells that story about Justin Bieber too, right? Misdiagnosed?
Yeah, initially diagnosed bipolar, but scans apparently showed something different. Possibly related to Lyme and past head trauma. It just underscores the need to look biologically.
Okay, so this brings us back to prevention and lifestyle. What are the core things Dr. Amen says we should focus on? The bright minds stuff.
Right. Before even getting into the specifics of bright minds, his foundational principle is something he calls brain envy.
Brain envy, like wanting a better brain.
Kind of. It's more about developing a deep appreciation and love for your brain, actively caring for it. He says people neglect it because it's invisible, and we're just not taught how crucial it is.
He had his own wake-up call with that.
Yeah, he saw his own scan compared to his mom's when she was 60, and hers looked much healthier. That motivated him. He realized things like alcohol, marijuana, bad food, poor sleep, they have immediate negative impacts.
So Bright Minds is the roadmap for developing that brain envy.
Exactly. It's an acronym covering the main risk factors you need to address. Let's walk through it.
Okay, B is for
Blood flow. This is huge for him. He says low blood flow is the #1 predictor of Alzheimer's on scans.
Wow. Okay, so what affects blood flow?
Lots of things reduce it. Head trauma, obviously.
Yeah.
Drugs, alcohol, too much caffeine, nicotine, poor sleep, high blood pressure, being overweight.
And how do you increase it?
Exercise is key.
Yeah.
Also things like ginkgo, oregano, cayenne pepper, beets can help. And he specifically mentions coordination exercises.
Like what?
Racket, sport tennis, table tennis, pickleball. Things that really work your cerebellum, which then helps activate the whole brain.
Okay, B, blood flow. Next is I.
Inflammation. He sees a lot of people with low omega-3, so fish oil or eating fatty fish is important. And surprisingly, maybe gum disease.
Gum disease, how does that link?
Bad bacteria in your mouth get into your bloodstream, cause inflammation, bad for your heart and your brain. Increases Alzheimer's risk. So, floss your teeth.
Good tip. Okay, R is retirement and aging and iron.
Yeah, it's about healthy aging. And iron balance is part of that. Too much iron can speed up aging, but too little causes other problems like sleep issues, anxiety. He manages his own by donating blood.
Interesting. G is genetics. We touched on this.
Right. Specifically the ApoE4 gene linked to higher Alzheimer's risk. But again, it's vulnerability, not destiny. Just means you need to be more vigilant with the other factors like exercise, head trauma, protect your head. Even small bumps can add up over time.
Yeah.
Toxins. Avoid them where you can. Support your liver, which clears them out. Mental health. This includes past trauma. He talks about the ACE score, adverse childhood experiences. Higher scores linked to higher risks for major diseases and earlier death. But importantly, he stresses you can heal from past trauma.
That's crucial. Okay, the second I.
Immunity and infection. Get your vitamin D levels checked. He aims for levels above 40, says it lowers cancer risk. He found his own were low despite being outdoorsy. Neurohormones. Things like thyroid, testosterone. He sees low testosterone surprisingly often in young men, possibly linked to head trauma or toxins. Recommends annual testing.
And this is where the personal care products come in.
Yeah, check your products for things like parabens, phthalates, fragrance. They can disrupt hormones. Use apps like Think Dirty. Go for cleaner options. Diabetes and diet. Watch your blood sugar, hemoglobin A1C, and your weight, BMI. Being overweight is seriously bad for your brain. Studies show its shrink brain volume makes it age faster. Plus, it connects to lots of the other bright minds risks.
And finally,
Sleep. Can't emphasize it enough. It's absolutely critical for brain detox and function. Non-negotiable.
so that's bright minds. A lot to think about. You mentioned seeing the scan helps people change. How does that work?
Well, there's knowing something intellectually, and then there's really feeling it, right? Seeing your own brain scan, seeing areas that aren't working optimally, it makes it personal. It creates that brain envy.
It gets past just the information stage.
Exactly. Though he also acknowledges other barriers. Low self-esteem, negative thinking patterns, sometimes rooted in early trauma, can lead to self-sabotage. You know you should do something healthy, but you don't.
So how does he address that side of things?
He uses a 4 circles approach for evaluation. Biology, that's the brain health, the scans, the bright mind stuff. Psychological, your thoughts, past traumas. Social, your relationships. And spiritual, your sense of purpose.
Looking at the whole person.
Right. He has exercises like the one-page miracle to define goals. And he talks about accurate thinking with a positive spin, not just wishful positive thinking. Plus, therapies like EMDR or ISTDP to deal with underlying trauma that might be holding someone back.
He used scams in addiction treatment, too.
Yeah, powerfully. Showing addicts the damage drugs or alcohol were doing to their brains was apparently a huge motivator for change for many.
Let's switch gears a bit to ADHD. You mentioned getting diagnosed later in life, which surprised you. Dr. Amen's view seems broader than just kids bouncing off walls.
Yeah, totally. That hyperactive stereotype is really outdated. He talks about these 5 homework symptoms of ADD.
Okay, what are they?
Short attention span, but crucially, not for everything. People with ADD can hyper-focus on things they find really interesting or novel.
Right. Makes sense.
Then distractibility, just noticing too much. Sounds, sights, feelings. Third is organization challenges, trouble with time management, keeping spaces tidy. Fourth, procrastination, putting things off, especially boring or overwhelming tasks. And fifth, impulse control, saying or doing things without fully thinking them through.
That's a much more nuanced picture. It's not just one thing.
Exactly. And his scans led him to identify different types of ADD based on which brain areas are affected, like classic inattentive, overfocused, limbic. 7 types in total.
7! Wow.
Yeah, each with slightly different patterns of brain activity and needing potentially different approaches. He stresses the genetic link, but also notes concussions can sometimes trigger ADD symptoms.
Fascinating. Okay, shifting again. Raising mentally strong kids. The stats on kids' mental health are worrying. What's Dr. Amen's approach here? He worked with Love and Logic, right?
Yes, collaborated with Dr. Charles Fay. And yeah, the situation with kids' anxiety, depression, self-harm, it's alarming. His core belief, the most powerful lever is parenting.
But parents need to be strong themselves first.
Absolutely, that's foundational. Then integrating neuroscience with love and logic principles. One big mistake parents make.
Is that?
Rescuing too much. Solving all their kids' problems for them. It stops kids from developing competence and resilience.
So let them struggle a bit.
Within reason, yes.
Yeah.
Give the problem back. You forgot your homework. That's tough. I wonder what you're going to do about that. Let them experience natural consequences.
What are the key principles he highlights?
First, know your goal. What kind of parent do you want to be? What kind of child are you trying to raise? Have a mission statement.
Okay.
Second, attachment. Real connection. That means dedicated time and active listening. Use phrases like, tell me more. Don't lecture. Don't interrupt constantly.
He has that special time exercise.
Yeah, 20 minutes a day. Child leads. Parent just observes and reflects. No commands, no questions. He shares this amazing story about his agent doing it and how it transformed his relationship with his daughter almost overnight.
Wow.
And be a good coach. Notice what they do right. Don't just focus on mistakes. Like training penguins, you reward the behavior you want to see more of.
What about teenagers? Communication gets tricky then.
Still need attachment, still need listening, but balanced with being firm and kind. Set clear boundaries. He uses the line, I only do nice things for people who treat me with respect. No permissiveness.
And the inevitable device battle.
His advice, delay, delay, delay. Supervise closely. Use parental controls. Be aware of the dangers porn exposure, the addictive design of social media and games messing with their dopamine.
So parents need to be the frontal lobe.
Until theirs fully develops, around age 25. Be willing to take devices away if they're causing problems, and educate teens about how these technologies are designed to manipulate them. Frame it like fighting an evil ruler trying to steal their time and attention.
That's a strong image. Okay, finally, let's talk tiny habits. What are some simple daily things Dr. Amen suggests for better brain health?
He has some great ones. Start the day saying today is going to be a great day, just setting that intention.
Okay, simple enough.
Throughout the day, actively look for what's right, what's good, counteracts our negativity bias, and constantly ask that question, good for my brain or bad for it. Make it a game.
Like the Chloe's game example he uses.
Exactly. And at night, reflect. What went well today? Go hour by hour, find the positives, even tiny ones. Research backs this up for boosting happiness.
I like that. What about food choices?
Ask, do I love it? And does it love me back? So does it taste good? And is it actually good for you? He uses alcohol as an example. Might feel good briefly, but doesn't love your brain back.
True. It comes back to making conscious choices.
Yeah, overriding the brain's inherent laziness, building positive habits.
Can a really negative person become an optimist with these?
He frames it more as becoming a realist, questioning negative thoughts like Byron Katie's work, using the rule of 12, considering multiple perspectives to build flexibility, even naming your mind, like calling the critical voice Hermie the raccoon to get distance.
Aha!
And treat yourself kindly like you would a friend. Adopt that we win or we learn mindset, instead of beating yourself up over mistakes.
Those are all really practical, doable things. So wrapping this all up, what's the big final message from this deep dive?
For me, it's fundamentally empowering. You really do have agency over your brain health, no matter your age or starting point. You're not just passively waiting to see what happens.
Yeah, you're not stuck. It connects right back to where we started. The brain can change, and you can influence that change.
Exactly.
So for you listening, we hope this has sparked some thoughts, maybe some motivation. Prioritizing your brain isn't just about avoiding future problems.
It's about living better now and building a better future for yourself, for the people you care about.
Definitely. And maybe the provocative thought to leave you with is this. What's the one tiny habit, just one thing from everything we discussed, that you could realistically start doing today to show your brain a little more love?
Great question to ponder.
Thanks for joining us on the Deep Dive.